AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health. Turn each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics. And, of course, where we do encourage you to call in to join in today. Well, folks, I got a bit of good news and a bit of bad. Let's take the bad first. The bad is that our scheduled guest today, you well know him, Dr. David Brownstein, left a voicemail on my answering machine telling me that he has dental issues. He had to get emergency dental something, and he will not be our guest today. Now, that is the bad news. And, of course, we'll get David to come back sometime in the future when maybe his dental situation is better resolved. But the good news is I contacted good friend Dr. Roy Kerry and brought him back to you today, more in line with a continuous presentation of where we left off last. We're going to be talking more about allergies today, in particular surrounding a new, very unique treatment that's been proposed by Roy and the folks that he, and colleagues and friends of his, that we hope to be able to bring to you. Of course, bringing you to that in the South Hills in my office. But Dr. Roy Kerry, the godfather of medical alternatives here in Western Pennsylvania, and certainly an ENT doctor, where allergy has been part and parcel to his practice for years. When he speaks, when he speaks on any issue, I listen. When he speaks on allergy, we all need to listen. And we'll be talking about LDA, low dose, sometimes called ultra low dose antigen therapy that is now available. You need to know about it for reasons you might not even be aware of just yet. So look, we're going to be talking and expanding on our topic that we brought to you just on Wednesday, today on a Friday show. So slightly different. It's not really the get 'em up out of town version that you're used to hearing on Friday, but it wasn't supposed to be anyway, if David Brownstein didn't develop the dental problem that he did. So we're going to be talking to Dr. Roy Kerry right after that first break. We'll bring you up to speed in case you missed the Wednesday show. You won't miss a stroke. We'll get right into the nitty-gritty of LDA, low-dose antigen therapy for allergies today, part 2 of our show from just Wednesday, a couple of days ago. In the course of our discussion with Roy, you want to call in to ask that question or make that comment. That number, of course, as always, will be 412-825-6262. That's 412-825-6262. I will give that number additionally throughout the hour. Now, this month is going by. It's happening fast, folks. We're in December. You know, that dreaded month, but yet that wonderful month when family's going to get together. I don't know how many shopping days are left. Hopefully you'll be smart and you'll do it on the internet this year, and spare yourself going out there and fighting those crowds. But you can stay here with us every morning, at least 3 days a week, 8 to 9, as we bring you the shows of the month. On Wednesday, you will not be let down to come. Monday we'll probably bring Roy back to make a threesome out of this. Wednesday, we absolutely have scheduled Susan Smith-Jones. She doesn't get sick, I understand, never gets sick. In fact, she tries to bring you ideas for how you won't get sick, or if you do, how to correct that problem with a non-conventional therapy. Susan Smith-Jones, our Dr. Va-Va-Va-Boom, our guest on Wednesday. The month will move on, of course. MCG testing is fully operational here now. At MCG testing that we've been initially bringing to you since February, and many of you took me up on an offer as we presented it to you on the radio show over the airways. This plea goes out to those who still think they might like to get this testing done. An insurance-covered test, 6 minutes is all it takes. Totally non-invasive. You lie in a bed. This device, literally in an EKG fashion, sweeps you every 82 seconds. Those 5 tests are sent off to be analyzed, and they're compared to a database of 42,000 plus patients. Each one of those patients has had this test, MCG, but they also had something else. They also had a full-blown cardiac cath, which was done to assess their coronary arteries, and that's what MCG testing is also able to do in a non-invasive fashion, and is 91% accurate as to the quantity of plaque inside of those arteries. So I offer that to you, listeners. If you want to take me up on this offer, give us a call, 724-942-3002. The dates for testing vary depending on which is more geographically pleasing to you. If you're out in the eastern part of the city, specifically in Monroeville or areas around it, our testing dates out there for the month of December will be the 6th, which is next Tuesday, and the 20th. 6th and the 20th in Monroeville. Here in the McMurray office, it'll be the 8th of December. Now, if you think you'd like to get this test done, a little after 9 o'clock hour this morning, give us a call so we can slot you in at either one of these 2 locations so you can get this test done. And then, as you leave from the test, what you want to do is schedule a time to go over the results on our very next return visit so as to be able to explain to you, well, what your score is and what that means. And then, I think the most important thing of all, just be able to correct this plaque deposition to improve these scores. That's what it's all about. That's where I think we are head over heels over the conventional use of this device, where unfortunately it's used to stage the doggone catheterization instead of trying to avoid it. Go figure. Okay, that's MCG testing. Of course, we announced the other day for the first time, and we'll continue to do so at some interval, but I thought I'd bring it back today, and that's the idea of the eye treatment seminar that you asked for. You called up during the show, even asked a couple of times, is he coming back? Talking about Dr. Edward Condra. And that's funny that you mentioned, is he coming back? Because he really left. He went to Rome, Italy. He's now at the University of Rome, working on microcurrent in the animal lab. I'm going to let him describe exactly what his position is, but he literally picked up stakes, took his wife, and is closing, or has closed, his Phoenix office. He's dead serious about this University of Rome thing, but he is going to continue to come back at interval to do these eye treatment seminars. We now have one scheduled for Pittsburgh here in my office in March. Here are the dates. The 22nd of March will be that free seminar where all of you out there, if you want to come in to visit with us and Dr. Condra, there'll be about an hour and a half seminar talking about eye issues as well as general issues. And also, that's the day he's in my office seeing the follow-ups of patients that he had treated in the past. Then on the 23rd, 24th, 25th, a Friday, Saturday, Sunday combination, he will put on another one of his 3-day eye treatment seminars here in the office for any of you out there who have eye issues that just are not responding to conventional medical therapies. And of course, I think they're the big 3, the biggest of all, with the most tragic set of consequences, of course, macular degeneration, really running rampant, and with the conventional therapies so poor and so pointless, literally, in getting improved vision. I guess about all the intention is to try to prevent you from losing any more of your sight. Macular degeneration in conventional hands really is a depressing thought. But in alternative hands, this thing turns up a lot rosier. Also, cataract formation and glaucoma. These 3 are the 3 biggest reasons that people come to these eye treatment seminars, because, as you know, if you're afflicted by any one of the 3, things aren't too pleasant with your ophthalmologist in that conventional therapy. So, I give you a phone number now. This is the office in Phoenix, which, if it isn't really open, at least is manned by telephone to accept your call to enroll in the course given here in March. 23rd, 24th, and 25th is the treatment seminar. 22nd is the free seminar, not a treatment seminar, but just for the general public to learn more about these issues. Here's the number, 623-516-0010. That's 623-516-0010. Give them a call. Wait a couple hours. These folks are not up yet. They're 3 hours behind. But when you make that call, you can enroll and get more of your questions, specific questions, answered until we get an opportunity to get Ed on the phone. Now, there's 6 hours ahead of us, so it's more like 2 in the afternoon, something like that, over there. So it would work out well to get a show from Rome. It would be the first time to all of you, and I'll try to arrange for that to have Dr. Conrad speak to us all on what he's doing in Rome and what he'll be doing here in Pittsburgh. Okay. Let's do this, folks. I'm really looking forward to getting on to part number 2 of this treatment of allergies through a process really unbeknownst to any of you, or at least maybe first revealed on our Wednesday show, LDA, low-dose antigen therapy that is now available. We'll be talking about why you might want to consider it on our return with the Godfather himself, Dr. Roy Kerry. Be right back.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Through the Spirit. The blessings of Through the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Through the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Through the Spirit, a blessing for your good health. Through the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. This is a Friday version of the show. Normally a get 'em up out of town version where we have you call in and just ask anything on your mind. We're changing that a bit today. Actually, we're doing so in an emergency fashion. Our originally scheduled guest, Dr. David Brownstein, had a dental issue come up, and we'll hopefully get him back in the near future to discuss one of his many books, but was out there and had to think about, well, who am I going to put in this spot? Should we do a get him up out of town show or not? And they said, no, there's no way. After having introduced this very interesting, fascinating, and very practical discussion on allergy treatment with Dr. Roy Kerry, a quick call to him and said, hey, let's do part 2 today. We may even do part 3 on Monday and really cover this subject well. He graciously consented, and so we do have the godfather of medical alternatives with us right now, Dr. Roy Kerry. Roy, hello, how are you? And thanks for coming back on short notice.
Yeah, good morning, and I'm doing great. Greenville office today.
Yes, you're up in the Greenville office, and you do sort of vacillate between Greenville, that's way up there, and way up there, and then Porterville, that's just a little up there. Okay, so we should say, by the way, make sure you get a pencil and paper. We're just going to be able to give that information on how you can contact him on any matter whatsoever, but certainly in his level of expertise as an ENT doctor. If you don't know what that means, folks, that's ear, nose, and throat. The gentleman, as you revealed on Wednesday's show, since 1969 you've been out there carrying the torch with your black medical bag, and boy, that bag has had a whole bunch of tricks in it over these many years. Wouldn't you say, Roy? Is that a fair assessment? Your bag's a little different than most doctors' bags.
I'm a little tricky. I started out very conventional and soon learned you have to think outside the box a bit to get people well and get them healthy instead of sick care, which is typical.
Well, by virtue of you knowing that you had to think outside the box, and I have to say your colleagues don't really think that way, and it has made you unique for all these many years. I've come to really know and trust the things that you've done and the things you've espoused. You've been very, and I say once again, helpful to me and mentoring me in so many different aspects of the alternatives. But here's one, I mean, the subject that we launched on Wednesday is right in your bailiwick, because as an ENT doctor, it just had to be something you were going to get involved with. Treating of allergies when it comes to ear, nose, and throat pathology, I mean, that's like butter and bread. That's like peanut butter and jelly. The two go hand in hand, wouldn't you say, Roy?
Yes, I guess I took about almost a year to figure that out. We trained in surgery, and I trained all the way through the pit. Do a lot of surgical work, but we don't take care of the long-distance patients that don't like to have to operate on them every year. So after about a year or so, I learned that you need to do allergy to take care of the area of ear, nose, and throat. So I asked my buddy in Grove City, how do you do that? And he'd come over and watch me and then take the course. And the ENT group does have a subsection of otolaryngologic allergy. We don't say that long word very often, but ear, nose, and throat allergy is a separate subdivision in our training, and I'm a member of the AAOA, as we put it. We train the usual technique of injections to take care of the ear, nose, and throat allergies.
Well, in the course of you branching off from your conventional teachings and treating allergy, you have run the gamut, Dr. Roy. You've been there, and when every other approach was presented to you, you scrutinized it. The ones that have gained merit, you certainly brought into your practice. In particular, you were one of the first to practice this thing called NAET. We talked about it yesterday, the Nembutropod approach to using the energy treatments. Then we found out one of the disciples of Debbie Nembutropod was Ellen Cutler, who developed an entirely other approach to the treatment of allergies called biosets. And I know, and because we had Ellen on the show when she was in Pittsburgh many times, and you really took off and brought that into your practice and specialized in the treatment of allergies with these very unique therapies. Rather than getting into those therapies again, and they all had their day in your office, they have now, although they haven't completely fallen by the wayside, a new approach has emerged which you've put the full force of your reputation behind, called LDA. Low dose or ultra low dose or really, really ultra low dose antigen therapy, low dose antigen therapy, which really is had a unique launching on Wednesday. We're going to sort of recap it. In your own words, how do you want to recap the discussion of LDA? What is LDA? How do you use it in your office? And what might the listener be looking for, potentially considering that use for of this particular approach of treating allergies for themselves?
Well, first probably is the definition of what low dose is. Usually in our ear, nose, and throat allergic treatment, we dilute the serums, let's say from ragweed or grass pollen or something. We dilute it on a 1 to 5 basis. 1 cc, let's say, of the antigen prepared by the commercial companies, and 4 cc's of water or saline makes a 1 to 5 dilution. And we do that repeatedly with that same bottle. Now that's diluted, we do it one more time. That's 1 over 5 to the second or third power, and then you go out to 5 and 6 in on rare occasions 7. It's as dilute as we go. With the low-dose antigen, we start at 7 or 8 and go out to 17. Now, in numbers, that's 1 over 10 quadrillion. And so that's ultra-low dose, and that makes it totally safe. This was developed in Britain in the mid-60s, and no one has ever had a fatal reaction from this type of injection. So it makes it totally safe compared to the lower, stronger doses where people have died from this testing and have died from the injections. If it's too high for that particular patient, this is why in Britain you're not allowed to do any of the therapy outside of a hospital setting, but this is allowed in doctors' offices, whereas other types of injections have to be in a hospital where you can resuscitate people successfully.
And just for the heck of it, why is it that if somebody has an allergy, you give them the very thing that they're allergic to? Because this is the foundation of all allergy treatment, whether that treatment's conventional or in this case an alternatively used approach. Nonetheless, why do you do that? What is it about that that can be helpful in you conquering your problem?
Keep it in simple terms for the layperson. You get a reaction when you have too much antigen compared to the amount of antibody that you're making. If you have it balanced, you don't have much of a reaction. Otherwise, there's a big histamine release and complement cascades and a whole lot of injurious inflammatory things occur when you don't have these balanced. So that's the trick of the type of testing we do in ear, nose, and throat. We balance it. Sometimes we call it neutralization is one of the techniques. You give the exact same amount of antigen to match the antibody in the globulin system, then you don't get much of a reaction. So it neutralizes that down. The LDA system is a totally different concept. It's, so to speak, training the T suppressor cells to go off into the body's area, and where the helper cells or activator cells have caused you to be allergic to things that you shouldn't be. Now, you need the immune system to keep your antibodies up against bacteria and various things like that, but you don't need to have antibodies against ragweed or foods. That's kind of silly, but the proteins of food that might absorb you get reacted to, and then your allergic mechanism says to your body, oh, reject those foods, and that doesn't make any sense. So the Stewart technique with an extremely low dose works on a totally different level of training your T cells, and they have a half-life of at least 60 days. So that's why we only have to give the injection every 2 months for about a year.
Well, that certainly sets it apart, and of course, hidden in that answer, and I will tell you, because I hear them, we did mention it the other day, the conventional allergy approach follows the approach with immunoglobulins, which is the B cell system, and this one, by working at a completely different level, attacks the T cell system, and in so doing, there must be a tremendous advantage to that, because in the case of the standard allergy treatment, you had mentioned to us the other day that you start out with a certain dose, probably 1/5 of a dose, at the power of up to 5, but they increase the dose with each and every treatment, or as treatment goes on. The higher the treatment, the dose, they figure the better contained your potential to react is. And here, it's completely different off the concept. You start extremely low, and you stay extremely low, which makes this an extremely safe therapy. Wouldn't you say that's the reason behind the safety, Roy?
Right. We stay with the extremely low therapy, therefore puts the risk to zero in terms of life-threatening side effects. Of course, we were taught from day one in medicine to do no harm, so this gets us that capability of doing no harm at all. It makes it fun to not get too worried about severe reactions. Not saying that people don't have some side effects and have a bad day once in a while when we do this, but for the most part, it's much safer.
Well, I thought another very interesting thing about this LDA approach is the multitudinous number of antigens, some 300 plus, all found within the substance that you're going to administer. You're going to give it intradermal injection. It's going to be a skin wheel you bring up on the forearm, but in the very solution that you're administering are contained, I'm going to use the word all, but let's just say the multitude of those known to provoke allergies are found in one injection, as opposed to in the conventional world, they use an individual skin test for each one all by itself, don't they, Roy?
Yes, and that seems to be the principle of the FDA. One thing for one disease is the principle that they'd like to research of, but this goes way beyond that, where you're treating everything you can think of, and for that reason, you don't need to do a lot of testing to prove that you have this or that, because this treatment for the whole 300 things is so, one, safe, it covers the waterfronts of everything you could possibly be allergic to. If you might be allergic to some unusual food from Tahiti and it'll be on the list, well, it probably crosses reacts to another food or fruit or something, so it covers things that aren't even in the serum. For instance, we don't put pesticides and herbicides in. We don't claim to fix those if people are violently allergic to them, but the balance of the other things in there brings your allergic load down, and those people do get some help.
Outstanding. Okay, a couple things to pull this close about the treatment, and I do like to see comparisons between LDA and the conventional treatment. I thought it was very interesting that whenever the conventional allergist is treating someone with a very severe allergy, and what you had mentioned the other day was, if you've got a peanut allergy or a shellfish allergy, these are very well known because of the protein molecules are extremely large, the reactions are extremely violent, and they could actually precipitate an anaphylactic reaction, and that actually has resulted frequently in death. This would be a person that would be seeking the help of an allergist for life-threatening reasons, and yet, as you revealed to us the other day, by the very nature of having such a violent reaction, they can't treat you for that. You don't get treatment if you have a very highly reactive set of antigens that your body works against. In fact, all they do say is, look, you're really in bad shape. I'd really like to help you, but you got to get out of my office. Here's an EpiPen. Carry it with you, and know that your cell phone can dial 911 on speed dial. That's about it, Roy, isn't it?
Yeah, in fact, even testing people with these items is virtually contraindicated, especially in an office setting. And don't even want to test people. Now, those people know that they're allergic to peanut or shellfish or something, and they don't need tested, and testing is actually a contraindication. It's medically unsound. So get the EpiPen and inject that and know where your closest hospital is, because don't even trust the EpiPen. And now we give people dual units that you might need a second injection before you can get to expert medical help at your local ER. So that's what they have to offer with that. But this one helps that. Now, with most anything in medicine, I don't use four-letter words. I'm a Christian, and so I don't use four-letter words like medicine is cure and well we don't use. But we're getting probably over 70% success rate with helping people with these kind of anaphylactic food allergies. And they're in there for everybody. Since the dose of shrimp or whatever is so low, it's safe to put in everybody, whether they have an allergy to it or not.
That is fascinating that you actually can treat these life threateners when there is no treatment available at all in the conventional medical realm. Only reactive treatment if you should happen to get exposure to an allergen, which obviously, if you're a patient and have this problem, you want to do something to prevent. You don't want to have an EpiPen carrying around. I thought it was so telling, once again, of the big blemish in a conventional medical model where people really need some help, and they will not be able to get it because they can't even test, for God's sake. And did you do say that those kinds of allergens are found in this 300-plus low-dose set? They're in there, and they are able to be treated. And you say, if I just heard you correctly a moment ago, 70% of those people with life-threatening allergies actually are improved and are brought to a point where they respond in a lesser fashion. Did I hear you right, Roy?
Right. There's one good example of a chap that was very allergic to peanuts and would get asthma attacks just from breathing the dust from something. That's why they don't even allow them usually on airplanes. How are you going to get someone to emergency care if it's 30,000 feet up? This chap was running down the beach, and I think it was Martha's Vineyard, and someone was giving away free ice cream cones. So he grabbed one and took a big gulp running down the beach. And trying to get an itchy mouth and a little bit of a sore throat, so he ran back and said, "What kind of ice cream is that?" And they said, "Peanut butter." He said, "Oh, no, it'll be dead." But he managed to find someone who had a Benadryl, and then got to medical care a couple of hours later, and they gave him some epinephrine. But his total result was he had a sore throat and itchy and a little bit difficulty swallowing, but never did get any asthma symptoms from that. He had been on the immunotherapy for a year or so, which protected him from a life-threatening situation. So there's a few cases like that where people had some exposures and didn't need as much care as otherwise didn't have as much of a reaction.
It's a wonderful story, a success story for you to tell. Just a couple of other items before I really do want to plow in today on the actual disorders that you end up treating. But in terms of the process, the protocol for if somebody listening to us today felt, you know what, I think I'd like to pursue that kind of treatment. Describe what this treatment consists of, the staging, the timing, the amount of difficulty that they can expect in terms of after they get injection. I'm literally hearing you that they shouldn't expect anything at all, but what does the protocol consist of so that a person listening would know immediately, yeah, I think I want to do that?
Well, first, let me give a commercial. My office at Portersville is 35 minutes from the point. That's exit 26. I'm 79. Number is 724-588-2600. 588-2600. And that's the first step people can do is call the office and get an appointment. The next step we do is as the nurses take you through the phone, it takes a couple times coming in. And we may get a history of 4 or 5 pages of detail. Quite good, so I can read it well, and get that before the patient arrives at the office. And
by the way, Roy, you're speaking a little too far away from the phone. I think you're fading on us.
Okay.
Get closer.
Okay, the history then is on my page. I can read it before people even get here. And we take a detailed history about the allergic background. Now, if the person has had allergy testing, they're basically eligible for this. Anytime in your life if you've required allergy testing of whatever sort, you're eligible to do the treatment because you have allergies. And in addition, I like to do a computer workup, somewhat like we do for a bioset. Those people that have seasonal allergies have some food allergies and maybe don't know it. So we need to know if you do have food allergies to add that to the treatment. There is a single treatment for all the things you breathe that's easier. As you look at your list in front of you, the allergic rhinitis, seasonal rhinitis, nasal things, and itchy eyes that are seasonal, they only require 2 injections the first year, one 3 months before the season hits and one about 3 weeks before the season hits. Let's say you have spring tree allergy. Well, you might want to get your injection this month or next month, and then another one maybe in March. Then you're set for the year, and that's quite unique. And most people have to be on injections year-round, even though they have a seasonal event. Then, if you have food allergies, we add all the foods to the combination of all the inhalants, and that's given as a mixture of a single injection. And these are given every 2 months apart for the first year, and then stretch it out to 3 months in the second year, and the third year you might get a shot, you might not, every once in a while. Dr. Schrader himself has been on this since 91, and he takes his injection about every 18 months now just to keep himself covered. Nothing else worked for him, which drove him to England to find out how to do it, and successful for him, so he brought the technique to the United States and still leads us in our training and education and sponsoring the website, which, by the way, is simply www.drschrader. It's DR, no period after that, drschrader.com. And folks can get on that and learn about this whole study done 10 years ago or so, over about 7 years, and we tested and treated over 10,000 people with a success rate of from 89% down to 25%. There were 4 people that we tried with multiple sclerosis, and 1 person had some success with it. That's the worst result. The other things are up in the 84% on the average of that across the board of all these allergies. Back to your question on what's next, and I kind of leave the hard part out, and get people enthused about it, but didn't tell them the hard part. And that is, if you're allergic to foods, you have to change your diet for 3 days, because the potentiating enzyme, which is one of the key factors to this therapy, in addition to being extremely low dose, you have to use this enzyme and mix it in right as you give the injection. That's why it's required to be done in the office. You mix an enzyme, beta-glucuronidase, which enhances the sensitivity of everything in you. So if you're eating foods, you're going to make yourself more allergic to it. So for the day before the shot, the day of the shot, the day after, you omit the usual foods that cause allergies. What's left is things that grow in the ground are successful to be able to maintain somewhat of a diet control, keep your blood sugar stable, get you some carbohydrates during those 3 days. It's not terrible, just you got to do what you got to do. In terms of protein, we allow meats that you never eat. Most people don't use much lamb, so that's available in wild game, rabbits, and venison. If you don't use those very often, then you can use that as a meat source. There's no fat on the whole diet, so that gets a little bit of a problem, but you can't use butter because that's from milk, and you can't use margarine because that's from corn or whatever. So you have to participate in this strict diet.
For those 3 days, 1 day preceding, the day of injection, and 1 day post. Just 3 days,
right,
which might be initially, 6 times a year, but then rapidly dropping off to 3, and then maybe to virtually none.
Mm-hmm.
So small price to pay in order to get your problem corrected, when in fact there are no corrections that exist in other realms. So it is a bit of bad news, but it makes such good sense when you're trying to include 300 plus allergens at one time. You've got to be careful to make sure that you aren't setting off the very reaction that you're trying to prevent.
Right. Now, there's 3 levels of concern here. One is people just have the seasonal things, and they just do the injections out of the season. That's simple. People that have foods then have to do the special diet. The next group, level 3, is people that have chemical sensitivity, and they're actually allergic to various fumey things like petroleum, gasoline, diesel, perfumes, hairsprays, and those people, we instruct them, and you have to avoid these, and the best way to do that is simply stop breathing for 3 days. And I think that's the only way we would ever have a fatality if people would listen to us. But people won't cooperate when we tell them that little rule. So we just be as careful as we can. And like even with the inhalant allergies, if you have a cat, don't sleep with a cat for 3 or 4 days. Put it in the basement, or some people even put it in the pound or something if they have a severe allergy to their pets. I have one lady that's a horse person, and she does her barn work, but she doesn't do the immediate care of brushing the horses and that sort of thing, and tries to stay out of the barn a bit in terms of her hay allergy and so on. But people with chemicals need to be as careful as they can. Don't fill your car up with gas. Instead, stand there and breathe it, so if you're allergic to that. But that's a reasonable precaution that people that have this problem do anyhow. So it doesn't change their lifestyle very much to be able to adhere to this with the 3rd level of avoiding things that you breathe of that degree of sensitivity, giving you trouble.
Now, in each case, I noticed, because I was listening for it, and lo and behold, I think I heard it, that we're talking about people that have allergies. They already know. I mean, if you have an inhalation allergy to gasoline fumes, nobody had to test you for that anyway. You already know. If you are allergic to peanuts, no one has to tell you about getting tested. You already know it. And foods, too. So everything that you had just mentioned really deals with immediate hypersensitivity, where you, as a patient, sort of already know what it is you're allergic to. I want you to take a moment and talk about that in context with a whole other group of responses that it's almost impossible to know anything about, and relate it to symptoms you're having That would be called the delayed hypersensitivities. Could you spend just a moment on these two categories? Because one seems so clear already to the person, and the other, it would just be a giant dark morass. They wouldn't have a clue about why they're experiencing what they're experiencing, and it might very well prompt them to think, you know what, it could be an allergy if I heard Dr. Roy correctly. Could you spend some time a moment on that?
Yes, the delayed sensitivity, we actually look for that when we do skin testing on people, especially with molds. They often, if we do the skin testing on the arm and we say, now you look at that 2 days from now, we'll give them a roller review base of the wheels, and we have to adjust our results based on marked growth 2 days later. With the mold skin testing, we change our formula and weaken it a bit to make it tolerable. But foods, how do you figure that out? If you eat something and it gives you symptoms 2 days later, you can't even remember what you ate 2 days ago, and you ate 14 different things, so how do you know which did it? We like to do the computer workup, which is fairly simple and almost fun, especially for children. You hold a lead and we touch the acupuncture meridian, and the instrument has in it the electrical frequency of foods, and it shows up on the screen, and we print it out in green and red. Red's bad and green's good, and we give you 3 or 4 pages of 100 and some foods for about $100, and that tells you what they are. Now, to convince people, we then would say, stop eating those red ones for about a week or so, and then go back on 1 or 2 of them and see what it does to you. And by the end of 5 to 7 days, they feel well, and then they add a food back in, and they get this delayed reaction. Again, it might be a day or 2 later, and they say, oh, then I must have an allergy to it. That's kind of convincing, and we like the people to be convinced that the therapy is worthwhile. In fact, if you have a fairly severe allergy to a particular food, we advise maybe discontinuing the exposure to that for even a week to 3 weeks after the injection. But most people don't know what that is, so the 3 days is usually adequate. But if you have a violent allergy, let's say to milk or soy or something, you might want to just omit that. That's not impossible, just you got to change your lifestyle for about 3 weeks. If you find that the therapy doesn't work, it's something you're staying on that you should omit for the time to let these T cells mature themselves and learn how to behave around the allergy that you're exposing yourself excessively to. Most people on a daily basis, they stay sick forever.
All right. Now, let's swing a bit as the time moves on today to this vast number of individual diseases that LDA has been shown to be quite effective in. And as I look at this lengthy list, and I know you have a copy of the list in front of you, Roy, I've plucked, by the way, ladies and gentlemen, right off the website that Roy is talking about, drschrader.com, if you want to see the list yourself. But to me, as I look at this list, there are a whole group, and it was extensive of these, some 70 different, 66 different ones. The category of the common ones appear to always show up in your zip code, meaning ear, nose, throat, lungs, respiratory. This large grouping occupies an extremely large number of the individual problems that one can encounter. Can you sort of pull that together as an ENT doctor that you are, and over these many years of your practice, literally every ear, nose, and throat problem could have this connection to it, and you can expect that if you're having a problem like one we may mention to our listeners, that they should consider getting allergy correction in this way. To talk about ENT issues, ear, nose, throat, and associated other zip codes.
This list at the top of the one where the percentage is the highest is secretory otitis media and repeated ear infection was 89% and 87% success rate with the low-dose antigen therapy. A personal example of that is I had an associate who was an excellent surgeon and moved across the street and kind of competed with me in town here. And I went one year and looked at the OR schedule, and he did 270 surgeries on these children with putting tubes in.
Putting those tubes in.
Yes, and I'm not slow. When I trained at Pitt, I did 10 kids in just about an hour once at Children's Hospital and put them to sleep and clean the ear and pop the tubes in and get the next child and take the previous one to mother and help the child wake up. So I do that procedure, but I did 27 that year. A former associate across the street did 270, exactly 10 times as many procedures. Now, he made more money than I did, but I didn't think I could better care for these children that had problems with this allergy care. Now, that was before LDA. So the success rate is almost 90%, 87 and 89% on the current ear infections, especially in children. This has been used until about 6 months. Below 6 months, I would prefer the bioset technique because children do well with that. It's easy to do. In fact, my son had a baby out on the West Coast, got allergic to mother's milk. It's kind of crazy, but Dr. Cutter found that every child in the first 6 months, if they got allergy, they're allergic to whatever mother was eating and coming through the milk. And so we do a bioset treatment. I taught him how to do it over the telephone. He's about 2 weeks old and losing weight, butt rash, face rash. He did it once daily with the technique, and in a week he was well. After about 6 months, he started eating some food. I said, well, better take it over to Ellen Cutter. He has to live 5 miles from Ellen Cutter here in County, California, so she did 2 or 3 treatments, and now she's healthy, not allergic to anything. So these other techniques are effective, but this, I think, really out over 6 months would be an idea to treat this and avoid the surgical things. All the adverse respiratory problems this covers.
Have I got a misread? But I think that for some reason it lingers in my mind that the placement of tubes for otitis media and so forth, this isn't as prevalent now or as common now because your organizations have said you should limit the number. These should not be done like when I was at Children's on my anesthesia rotation. A couple of well-known docs there were 30, 40 kids in the hallway lined up on a morning, and I don't think that happens anymore. Or does it, Roy?
Well, the European experience with repeated ear infections, they don't even treat. They don't give the child an antibiotic. I think it's somewhat cruel if they have pain, but if it ruptures spontaneously, they drain and get better, and even if they don't, they seem to do well by building their own antibodies, I guess, and the European technique is not even treatment. I'm not sure that's medically sound, and Americans, without an earache, they all want an antibiotic and want to fix it, and they can't stand it. Their child screaming all night long. That sort of makes sense to do something. So treating the allergy, though, is the solution. For most children, it's just a few of the foods, and the problem is that most allergists can't test foods very easily. You don't want to have a 6-month-old child with needles all up and down the arm, and food allergy testing is fraught with maybe a success rate of 30 or 40% if you're lucky. So these other techniques are better with the computer workup. You do that with the child, and they sit there and laugh at the screen. It's enjoyable by comparison with sticking needles in their arm. This treatment, it is an injection, but it's one little injection that covers everything every couple of months on the forearm, and you can do a child just as easy as an adult, or you can hold that arm still just long enough. And it might itch for a little bit, but it covers everything.
Yeah, when you say injection now, we're talking about intradermal, just putting a little skin wheel up, and not a real, deep sub-Q or intramuscular style injection. This is just minimal. You may not even feel the doggone needle. It's so small.
It's about a 29 or 30 gauge needle, as big as a hair, that you put just barely beneath the skin and raise a little blood. If people have ever had skin testing, that's the technique. But instead of all over 2 arms or all over your back, it's just one on your forearm, and that's everything you need in the one injection.
Right. Excellent points to make about kitties. I wasn't even thinking about them, but hell, with the population out there and children afflicted with upper respiratory issues, to know that there's a way to get this corrected, almost 90% effective, coming from an ENT doctor, boy, that's the pearl of a lifetime. What about adults? When it comes to we might as well just keep the division upper respiratory today, and then on Monday we can go to these other areas of the body where you wouldn't even make the association. I think that one does make the association with potential for allergy when it comes to ear, nose, throat, and lungs. So when the adult side, tell me what your practice has yielded you in the way of making some sweeping generalizations about allergy treatment. Take it away, Roy.
The number 3 on the list is nasal polyps, which most people do have to have surgery for that. Their nose is completely blocked by these overgrowth that they perceive to, and it has a high success rate with the nasal polyps, but it's an allergic mechanism. And asthma, we'll move down to the pulmonary area, and people have marked difficulty, and that's, again, almost a life-threatening thing. Now, there's a lot of drugs out there for that. Now, they're reasonably successful, but the drug therapy has its own set of side effects. I've heard of a few people have known, a friend with a local dentist has found his daughter died from an overdose of the albuterol inhalers. She had such bad asthma, she overdosed and had a cardiac arrest. That's serious problems. And so this handles the asthma too, in children and adults. Asthma is being more and more of a problem in children. A little more difficult if we don't tolerate drugs as well. Some of these drugs are immunosuppressants, and that's a risky factor too. You know, the steroids, everybody knows that steroids suppress your immune response. Most people that know a bit of medicine don't like to do that. Sometimes they have to. The other interesting thing about steroids is that steroids with this treatment are not contraindicated, but almost all of them are drugs. Not only are contraindicated, they wipe the success of the treatment out completely. But even an inhaler, even a Tylenol 3 weeks after the injection,
that's interesting.
Benefit out. And all these drugs for arthritis and asthma are contraindicated during the time frame. So we put people on a short course of steroids, and they taper them back immediately after the injection given. Then they don't need much help for a month or so. And my first patient just recently did not require any inhalers or any drugs at all for 4 or 5 weeks after the very first injection. She was on 4 different inhalers, and some was off just every 3 or 4 hours. She was breathing completely free, not even a cough for about a month after the injection. So that's a bit unusual to be that successful, but it shows that many of these things can be fixed by just the very first time.
So a high degree of success with nasal polyps. That sort of surprises the listener, certainly surprises me. We thought this anatomical growth that has to be shaved off can be, I'm guessing, not resolved once present, but prevented from ever occurring. Is that the way I should interpret it?
Well, yeah, and if people have them, they're caused by allergies. They should treat the allergies, and sometimes you do need to get in there with the newer sinus surgeries and remove the actual overgrowth that it's hard to get this strange and it comes right back to most of the years. People may have to have several surgeries over time. It's not fun to have surgery every year or two to keep your sinuses open and clear with elbow pressure and headaches, face pain, etc.
One on the list here, which I'm sure is absolutely high in number, chronic sinusitis. That diagnosis is made frequently by me. Obviously, whenever I see it happening, I think, you got to see an ENT, I tell the patient. If you're having chronic sinusitis, there might be some anatomical structure, some anatomical obstruction. How good was my recommendation when I said that? Is that accurate, or was I in error by suggesting that may be it, when in fact allergy could have been the root cause from all this from the beginning?
Well, allergy is the root cause, but the routine treatment is decongestants and histamines and surgery eventually to open the sinusoids if the sinuses are blocked. The air inside absorbs and gives you pain from the traction given on the sinus lining. It hurts whether it's being pushed or pulled. And if it's under pressure with an internal infection and there's no room for the mucus to get out, the sinus is under pressure, and that can put intense pain that people who have sinus trouble know what that means. Looking here at the success rate for chronic sinusitis is 72%, and even headaches is 75% of other. That means any old headache. A lot of these things are allergic. Headache is not an acid deficiency. There's got to be some cause. Migraines are right up in there too. Migraines aren't a pneumothorax deficiency. It's a vascular thing caused by vessel spasm and expansion, which is then caused by the emergent mechanism. Go to the cause of the cause of the cause, and you fix that, and it's kind of done with instead of treating symptoms, which many where drugs do treat symptoms, don't suppress response.
All right. We literally have a minute to go, and I hope the caller calls back, because with just 1 minute to go, we're trying to round this up, pack it up today, and get ready for Monday. There are so many non-upper respiratory issues that have an allergy connection. I just want our listeners to know that on Monday, we should be moving into areas that you would never have imagined might have an allergy connection and may have an allergy treatment in your near future, especially when you figure that, as I looked at the list, Roy, every one of these other zip codes of the body, every other have no real corrective treatment. There is no correction for them, and so consequently, I think everyone's going to be wanting to listen on our Monday show as we go over those other disorders apart from the respiratory system and the ENT area. As we pull it close today, once again, would you take the time in a commercial fashion to talk about how patients can get a hold of you to get this started up there at either your Portersville or your Greensville office? Give that phone number once again, please.
724-588-2600. So that's the Greensville number if we get all our appointments here. We're in Portersville just on Wednesday currently. I'm trying to expand that practice to all your people from the North Hills. So I can receive this patient in my office nicely, but I can't receive it in the Greenville office. So when people at the North Hills, I'm going to exit E6, about 79, very first building on the left, and you can see my building. Almost helping. You can't miss it. If you give me that kind of direction, I can't miss it, but it's hard to miss my building.
There you go. Roy, thank you once again for pinch hitting today in the fashion that I knew was going to be stellar. Monday, we'll bring this topic to an end, talking about those non-respiratory components for allergy treatment. Until then, this is Dr. Dennis Courtney with Dr. Roy Kerry saying so long for AM Impact on your health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724